Hi, I'm Professor Vicky Karkou from Edge Hill University, Director of the Research Center for Arts and Wellbeing. And I'm here with the WHO lead for arts and wellbeing and prominent arts therapists from around the world. We're here to discuss the role of the arts and arts therapists in the pandemic. On behalf of Edge Hill University and the Research Center for Arts and Wellbeing, I would like to welcome you all to this session that attracted quite a number actually of delegates, highlighting how important this topic has been for people from around the world. This was an event that was originally planned to go live, and it has been organized in collaboration with the International Arts Therapists Doctor Alliance that is chaired by Dr Nisha Sajnani from New York University. And I'm going to bring Nisha in now to introduce the topic and the panelists.
Thank you, Vicky, and it's a pleasure to co-host this event with you and with all of our wonderful panelists. I think we'll have a wonderful discussion here, focusing on this primary question of how the arts and arts therapies contribute to health and well-being in the context of the pandemic. We're very pleased to be able to have Christopher Bailey with us today. Christopher is the lead for the arts and health for the World Health Organization and a performer and director in his own right. And we're also joined by Professor Felicity Baker, who's the head of music therapy and director of the International Research Partnerships for the Creative Arts and Music Therapy Research Unit at Melbourne University. We have Dr Azizah Abdullah, who's a senior lecturer in expressive arts, counseling, and psychology at University Utara, Malaysia. She's also a registered counselor with the Malaysian Board of Counselors and a member of the National Counseling Educator Association in Malaysia. And we have Professor Vicky Karkou, of course, who's the director of the Research Center for the Arts and Wellbeing at Edge Hill and is a qualified dance movement therapist and also the joint program leader for the MSc in Psychotherapy and Counseling, Contemporary Creative Approaches. We're going to begin with an opening statement from Christopher, and then we will move towards our panelists and then open up the conversation. So I'll pass it to you now, Christopher.
Oh, thanks so much, Nisha, and greetings everyone from Geneva. Perhaps I'll begin first of all to explain my rather funky lenses. I am virtually blind. I have terminal glaucoma and less than 5% vision. About a year ago, a little more than a year ago, I lost the ability to recognize faces. And what was interesting to me, when you lose something so fundamental, there are, of course, different coping mechanisms that come into play. And in my life, since I am in some ways half in the world of science and half in the world of arts, both came into play. I'll talk a little bit about science now, and then towards the end of my 20 minutes, I'll talk a little bit more about my artistic reaction to it. But one of the things that gave me comfort was trying to understand what was happening to me. And as I would try and make sense of the world with so little visual information coming into my visual cortex, I began to realize what the visual cortex was about. It represents 1/5 of the brain's capacity, and part of its function is to take that information and try and make sense of it, to find patterns. And when you're getting a paucity of information, it begins to fill in the blanks. And that resulted with me with hallucinations, where I would take a walk in a neighboring park in Switzerland and see a palm tree. I would run into an old friend and see them as if we were just meeting each other 20 years ago. So there are some advantages to it. What I began to realize quite dramatically in terms of our perception is what Wordsworth and others saw in their poetry generations earlier, that our experience of the world is half of what we see and the other half what our mind creates. And our systems abhor a vacuum, like nature. So when we look up at the stars, it is impossible for us to imagine randomness. So we take that randomness and we begin to impose an order. And that order is drawn from the stories of our culture, from our personal experiences, and we project that back out onto the randomness, and it becomes the constellations. This is particularly true in a time of crisis like a pandemic. In the early phases of a pandemic, where the need for information is so great, and the stakes are so high, and the actual availability of information is so low, like my glaucoma, we begin to see patterns that aren't there. And this is how rumors start. And it's why the scientific method is so important, to be able to take this very human quality of myth making from little information and begin to separate out what is verifiable fact through the scientific process and what is a comforting story. In the pandemic, we are facing essentially two epidemics. The first is viral, that we're aware of. The second is of misinformation and sometimes disinformation. And this is nothing new. When I was on the ground working with teams in the 2014 Ebola epidemic in West Africa, and we would go into a community or a village, oftentimes when we would explain why you need to wash your hands, why safe burial practices are important, why a body might need to be given over for proper burial. Sometimes the people in the village would respond and say, yes, that makes sense. But often there would be a fear reaction, and they would blame the messenger. They would say, well, we didn't have this disease until you people started telling us about it. Maybe you're bringing it. All sorts of strange rumors coming out of fear and hope as well. And so when the COVID-19 pandemic began to arise and WHO itself came under attack, and other equally prominent and authoritative organizations, and new rumors of potential cures or treatments or denials that it's even happening, or anger at people bringing what little information we had, or anger that we didn't have all the information up front. All of this is not a surprise. It is a human reaction, because when faced with little information, we always try and find a narrative. And it's very, very hard to accept when the narrative hasn't been written yet. Part of the role of the scientist is to be disciplined and through the scientific method, find out what is true and what is not, to apply it to a crisis, which is very difficult when time is an issue. And part of the role of the artist is to give expression to that anxiety and begin to make sense of it in an authentic way and imagine the future. So how do we do this at WHO? Well, we do it at the local level with comedians, improvisational acting troops. We have a network of artists around the world. As part of it is not just the health messaging of telling people what they can do to break the transmission chain, but also to give an authentic voice to people's actual experience. Communication goes both ways, is both talking and listening. And artists are uniquely positioned to be that interlocutor between the heart and the mind. The most famous example of a response that WHO had in this particular moment is probably the Together at Home concert that we did with Global Citizen and Lady Gaga, and my colleague Paul Garwood did a lot of the heavy lifting on. And just to take that for a moment, that concert was broadcast simultaneously across almost every major broadcast and digital channel around the world. It, according to the Guinness Book of World Records, and I know it's true because we got the email from them, we broke records for the amount of money raised in an online fundraising benefit and the number of groups booked for it. So we're good for bar bets for the rest of our lives. But the other thing that this concert did, it worked on several levels. On one level, we got the message across to wash your hands, to maintain physical distancing, to stay at home, to support each other. All the key public health messages that we wanted out there were delivered in a way that people could hear. The other thing that we accomplished was providing a sense of comfort and community. Together at Home was a conscious title that part of the goal in all of this was solidarity, that just as the fear reaction to create myths around a crisis is a human one and common, so too is the impulse to run away from each other, to not stand together. And we've seen historically in epidemics, in pandemics, that when you exclude, when you divide, it only intensifies this ferocity of the epidemic. But when you stand together emotionally and intellectually, that epidemic comes under control, even if you are physically distant. The other aspect that began to emerge from that concert was an immediate identification with the celebrities. And this gets back to the unique role of performance and art. In life, it takes time through repeated positive interactions to build trust with people. And certainly with scientists and academics who are spouting data and facts, and there's a tendency for them to feel distant and aloof and not feel a personal connection with them. And so even if they are telling you facts that will save your life, the trust is not in the intellectual part of the brain. The trust is in the midbrain, the relationships, the sense of identity. And this is the place of narrative, of story, of art. And so what happens when you go into a performance space, you have a leap of faith. You immediately short circuit that time consideration to build trust in a relationship, and you automatically trust this fictional character or this celebrity from this imagined relationship. And it's a way of being able to have instant trust. And it's something that has evolved in our species from performance from the beginning. And it's something that we need to be aware of to use it in a positive and constructive way. And then the last element that came out of this concert, beyond solidarity, the messaging, the comfort, was something that I only heard about yesterday. I was on a panel with the Aspen Institute, and the subject came up, and some of the academics there said, you know, what we're hearing from the younger generation is that a whole generation of people were exposed to public health and health sciences through that concert. And they're hearing children not only having the agency to do something to help in the pandemic by washing their hands, etc., but realizing the beauty of being able to help others in a systematic, science-based way. And many of them saying that they're seriously thinking about a career in the medical sciences or public health, which is not something that was an objective of ours, but a beautiful thing to hear. What is this connection between art and health? It is very old. If we go back in time to the very first healing ceremonies, what we'll find is that the healing ceremony was the same thing as a theatrical performance, as a musical performance, as an athletic event, as a religious event. There was no difference. And still, all of these things were separated for very realistic and practical reasons over the millennia, still share some common DNA. And that common DNA, I think, can be identified by two events that happened about 70,000 years ago at the midpoint in the evolution of our species, something called the cognitive revolution. And it wasn't our ability to think. That had already been established. The first sign of this cognitive revolution was painting a human figure on a wall with an animal's head, a work of the imagination, something that does not actually exist in nature, that was created in someone's mind and given representation. The second event that happened was the first archaeological evidence of a healed, broken femur. Prior to that event, if you broke your femur, you were left to die. You would be a liability to the tribe. But at some point in our minds, we conceptualized that sacrificing the efficiency of the tribe to stay and care for that injured person had a value. That person was worth it to the tribe. In both instances, two things were happening. One was a sense of compassion and empathy. Empathy is the driver of the arts. It's also the driver of healthcare. The other thing that's happening at the beginning of artistic and basically scientific inquiry is this notion of the magic what if. To take the information around you and imagine what could be, that sense-making ability. In science, we call that the hypothesis, and then we go through the scientific method to see whether that's actually true or not. In the arts, the magic what if serves a different purpose. It's to create a reality, an emotional reality by which we can help understand what's happening. And if we go back to ancient Greek theater, their notion of catastrophe, I think, speaks to this process well and perhaps shows the role of the artist in an event like COVID-19. The Greeks had a very specific definition of catastrophe. It was different than a disaster. A disaster is something terrible that happens. There's nothing you can do about it. Too bad, right? In a catastrophe, the event is the same. There's no difference. But if you can find a meaning in it, it becomes an overturning of the social structure. In the catastrophe of COVID-19, suddenly politicians are powerless and we are all dependent upon green grocers. There is a social overturning. We find a meaning in it. In my own personal journey into blindness, when I first realized that I was losing my vision and my engagement of the world was threatened, it felt like a kind of a death. And I went through all the stages of death, of anger, of grief, of bargaining, of denial, and eventually acceptance. But more than acceptance, it was making it part of my identity. And this was not a natural state. This is not a medical thing that happened to me. This was an act of the imagination and of will on my part. To describe it to you, when you willingly close your eyes to sip a glass of vintage red wine to better taste its flavor, when you willingly close your eyes to better embody a piece of music, when you willingly close your eyes to trace the gentle slope of a lover's forearm, so too do I willingly close my eyes to better live this moment with you. That's the healing power of art.